So how many of you want to wait until 2014 for the health crisis to be solved? Raise your hands. All right, well, today I'm going to tell you how we can do it right now with the tools we all have. But the first thing we need to understand is, why does healthcare cost so much? And the reason it costs a lot is because we have a third-party payment system that promotes overuse. Doctors practice defensive medicine. And then we also have treatment. Sorry, I'm pulling a Sarah Palin. Our doctors get paid for treatment and not for outcomes. But the real problem is that 70% of our diseases are preventable. And even worse, 70% of healthcare costs are preventable. We had $13.1 billion in other costs, like lost productivity, just in Colorado alone. So then you have to ask, well, how did this all happen? How did this problem become so big? Well, we smoked, we drank, we ate McDonald's. We built these big houses in communities without sidewalks, and we drove everywhere. We had long commutes to longer jobs. And ultimately, we kind of got heavy, and chronic diseases came. And then our health care turned in such a way that you can't go buy prevention at the pharmacy, and health care only pays for drugs and treatment, not for prevention. Furthermore, employers are somewhat to blame in this whole problem, because they've just simply passed the buck to employees. They've increased deductibles and increased copays, and in the end, really didn't fix the problem. They didn't innovate. If you look at this chart, you'll see that employers are the only ones that have any bargaining power in this deal. What, Medicaid? Are they going to go and innovate and try to drive change? The small group market? Not going to happen. So businesses are really the only ones that hold the key to this solution. So you ask, what is the solution? Well, it's workplace health promotion. And the World Health Organization has come up with, I think, a really great definition, and they call it the ideal setting and infrastructure for the promotion of health to a large audience. Doesn't get much better than that. So then you have to ask, well, why does it work so well? Well, we spend half of our day at work. The workplace is all around us. Everything we do in our given day, you know, like what do we eat for lunch and maybe even dinner, is driven by what we did at the workplace that day. Did we exercise? So the workplace has an effect on our health through social aspects, as well as the policies, the plans, the organization, and even your building structure. So the workplace can really help affect health for the better. And it can do so by promoting programs like physical activity. You could encourage your employees to exercise at lunch, or even just have walking meetings, or even just encourage them to go for a short walk on a break and stretch their legs. Or you could have a nutrition program, or you could improve your vending machine choices, or even let's just get the donuts out of the break room and get some fruits and vegetables for people so that we can actually get our daily intake up. Stress management. Being happier, healthier. I just read a study, I think on Monday, saying that happy employees, or companies who have happy employees, are 44% more profitable. So it doesn't get much better than that. Tobacco. Remember when we all used to smoke at our desks? Well, I didn't smoke at my desk, but that was back in the 80s and the 90s, and we don't smoke at our desks anymore. So you can see that that really helped. Peer pressure. You know, peer pressure can also be a good thing. Your cube mate, you're like, wow, you look great. You've lost 10, 15 pounds. You may decide that you want to join your cube mate for a salad and a walk for lunch. The reality is that employers don't even realize they have this whole toolbox available to them and ways to align their healthcare plans to promote outcomes. It's just they don't realize that they have it, and someone needs to educate them on how to use these tools. And more proof, I found this study. It was a meta-analysis. 26% reduction in healthcare costs for organizations that have comprehensive workplace health promotion programs. That's a pretty big savings. I think most of our bosses would be pretty happy if their healthcare costs were 26% less. So what I'm saying is, you know, businesses start putting in wellness programs, and you can have a healthier, happier workforce and save a lot of money. Doesn't get much better than that.